Hello, I'm Dr. Samantha Copeland, and I'm an assistant professor of philosophy and ethics at the Delft University of Technology. I've worked in bioethics and with clinicians, but I don't have any experience myself in the clinic, I confess. I do, however, do a lot of thinking and research and teaching about how people reason, and especially about how they reason through ethical problems in practice. And I'm here to give you a philosophical perspective on ethical reasoning in the clinical context. Why is a philosophical perspective important to have? There is one really good reason, the reason I'm here. Philosophy gives you a language to talk about the complex situations you will find, and you will find yourself in, as you try to reason through and about ethics and medicine and life and relationships and how to live in this world, all at the same time, in education and in practice. Just like psychology gives us a language to understand how we feel and behave, and medicine a language to explain disease and disorder, philosophy and ethics give the language that we can use when we are struggling through complexity or when we face a dilemma. More than words, the concepts I will talk with you about today are tools you can use to figure out what to do and how to proceed. The first step to figuring out what to do is figuring out what you think. I work from the principle that everyone already does ethics. Ethics is a word for what we think about how we ought to behave, and about how others ought to behave. An example of an ethical question is, what are the basic needs of people? What do people need to have a good life? And what kinds of rules will help us best get along? What are our rights? To get to your ethics, you can start with the judgments that you make, especially the judgments that you make about other people, but what they might need or want, and especially about whether they behave correctly or appropriately. These are called normative judgments, and they are evaluative. They say something about whether you think someone or something is good or bad, or whether they behave rightly or wrongly. You might be thinking, I can think of lots of judgments about what people need that aren't normative, that don't label them as good or bad. For example, people need to eat. Clinical judgments seem like these. If you judge that someone needs a particular intervention, this is a reasonable judgment, a logical consequence of a rational evaluation of the evidence as valid and sound. We'll get to those concepts in a minute. And so a correct conclusion has been drawn and applied about what to do, right? Give the person something to eat. But then we have to ask, what do we give them to eat? Is it okay to have our vitamins in our donuts? We have debates about what counts as healthy choices, what kinds of food people really need. And sometimes our health needs don't match up with the possibilities we have for eating. In these cases, things can be quite complex, and normativity and science tend to interact. To help us sort those out, let's go back to philosophy for a minute, and to those concepts I just mentioned, valid and sound. These concepts are about arguments. A sound argument is also valid, but a valid argument is not always sound. The classic example of a valid argument is called a syllogism, a quick collection of sentences that, when put together, make an argument that is necessarily true. These tend to work kind of like definitions. For instance, Socrates is a man. All men are mortal. Therefore, Socrates is mortal. If the premises are true, if Socrates is a man and if all men are mortal, then Socrates has to be mortal. This is a valid argument. The truth of the premises, or what we might call the evidence, is what makes the conclusion necessarily true. But it is, of course, not so simple. Note that I said, if the premises are true, then the conclusion must be true. Now, in the Socrates syllogism, we seem to have a simple case of this, where we know Socrates was male and that all humans, and that males are humans, are indeed mortal. That is, we know that this is also a sound argument. The premises are really true. But this isn't always the case. If I offered the premises, for example, all trees are tall and daisies are a kind of tree, then it would be a valid argument to conclude that daisies are tall as trees. But this is not a sound argument. Not all trees are tall. And more obviously, daisies aren't trees. So no matter how true the conclusion must be, The if of the premises truth relies on our imagination, not reality. Sound arguments, importantly, must also be valid. That is, you can't just say anything true about the world and draw a correct conclusion from it. The premises still have to work together to necessitate the conclusion to have a good argument. You might be wondering at this point why we're taking this detour. Well, let's think about what makes a clinical judgment. Even an unbiased clinical judgment that correctly weighs all the evidence is both valid and sound, yet value-laden and normative. To start, consider we might indeed get validity in the case of a diagnosis and prescription, where a correct conclusion has been drawn, given all the available evidence and good medical scientific principles followed from moving from evidence to action. But often in reality, we lack such complete evidence and clear principles. Such judgments happen in contexts where helpful evidence is often missing, or new evidence is just arriving. Guidelines may be adjusting, and patient needs are always unique. In one way, this can raise doubts about the validity of our reasoning, because new evidence or changing circumstances may affect just how much our conclusion must pertain. In practice, we rarely deal with pure deductive logic. We do the best we can when it comes to validity. That is, we make assumptions. Sometimes these assumptions are pretty bad, and sometimes they mislead us. Sometimes they're not grounded in much evidence. But they don't have to be just opinions or ungrounded. In fact, they're needed by us every day and all day long as we reason our way through the world. I assume that the train schedule is true, and that the cars will stop at the red light, and that my students will listen. Without these assumptions, I would not try to commute on a schedule, or cross the road when the green person appears, or write a lovely lecture replete with interesting facts. Note that these assumptions are not only about the way the world is, that the sun will rise tomorrow, for instance, but they're also about the behavior and the values and the commitments made by other people. Such assumptions play the role of hidden premises in an argument. The Socrates syllogism had only 2 premises, but underlying those are a number of assumptions, hidden but equally important for making the conclusion necessarily true. If only these kinds of 2 premises are true, then we have something more like a definition, as I mentioned, not really an argument. For instance, a bachelor is unmarried by definition. A bachelor cannot, by definition, be married. But in the case of Socrates, all men are mortal seems to be quite valid and sound, but is it possible that a man could be immortal? If it's not true by definition, if it's not something that we've defined, it's not just a word, but rather a thing out there in the world, then the possibilities might be open. And we might still have to argue for that premise too. This may seem trite with examples like Socrates and bachelors, but the same thing applies to other questions too, like, can we change our genes? This question could be answered firmly in the negative by a previous generation, but we might answer it in the positive now, given advances in technology. It's not genes that have changed, but what we know and believe about them and what we can do with them. Even when it seems we are dealing with definitions, we often are not. Or at least because our understanding of things tends to change, we need to revisit those assumptions and check so often if they're still correct and can support our arguments. That is, we need to ask, can they still do that hidden work to justify this argument I am making or this way that I'm behaving? You can probably think of at least a few examples of how what we think of as correct behavior has changed over time. New social norms that have become accepted or old social norms let go of, like smoking being allowed and then not allowed. In these cases, we have re-examined our justification for our behaviors and found them wanting. So we have had to change the argument by taking in new evidence and letting go of old assumptions about marriage, race, eating habits, contagions, and even the weather. Where assumptions, hidden premises, and open questions are concerned, values can play a more obvious role in determining what will count as evidence for which conclusions in our arguments. That is, these are the places where we can really see values making a difference. In these cases, values can help us tip the balance one way or another. Values can act more or less like preferences in our reasoning. I hold my autonomy valuable, so my doctors respect that value by allowing me to take an active role in decision-making about my cancer treatment. But as a patient, there are only so many ways that I can make a difference with those values. The doctor still provides me with their evaluation of the evidence and the options I have. And even if I do my own research, I cannot influence the results of the trials I read or the words of the articles authors have printed, for example. For these reasons, we often think of values in the clinical context as an added dimension of evidence about which decision is the best one. We take up scientific evidence, contextual factors and constraints, previous experience, and in addition, patient preferences as the key aspects to consider during the decision-making process. The values are not actually separate from the rest of these considerations. They are not only preferences, reflecting personal desires or cultural beliefs. They are not only one category of evidence. In fact, values and beliefs and assumptions shape all the evidence we have, and even what we think counts as evidence in the first place. Let's think again about when arguments are sound and what values have to do with that. A famous story of discovery has been widely used in philosophy to explain how seemingly sound arguments can be called into question. Once upon a time, that is, before the discovery of Australia by the English, Europeans could hold to the argument that all swans are white. Indeed, the idea of a black swan was raised as a theoretical absurdity in thought experiments. So strong was the assumption that there could be no other kind of swan. When native black swans were seen in Australia, a concession had to be made, and the definition changed. When we understood swans as birds of different possible colorings, the underlying assumption that there could be only white swans had to be let go. It could no longer justify an argument such as the Socrates syllogism. This bird is a swan, this bird must, in conclusion, be white. It was no longer a sound argument. Again, this might seem silly, but when the male body was assumed to be the stable default human form, and women's bodies by comparison were understood as a complicated and fluctuating alteration to that form, there was good reason to do all the medical research with average men, the standard human. Scientific results could only be cleaner and causal relations more clear in research results that can control for the interferences of female anatomy. This belief, assumption, guided approaches to participant recruitment for a very long time because the assumptions behind it were not called into question. Ethical implications of these assumptions include exclusion, gendered approaches to drug diagnosis and intervention, and a paucity of good evidence on pregnancy and drug interactions, to name but a few. So failing to identify and call into question the assumptions that underlie our justifications for even something so scientific sounding as what counts as good evidence in medicine can have broad implications for people. Therefore, this kind of reasoning is ethical reasoning too. In the clinic, scientific reasoning, ethical reasoning, and practical reasoning are all used together and cannot be easily separated. You must take into consideration the best scientific results available to you, the practical matters of what options are actually available and which ones might really work in this case, given the circumstances, as well as the potential implications of all of that on the patient, and in terms of medicine as a practice and a profession. That is, you wear many hats. One way to think of ethical reasoning is as the way you manage to balance all of this. Another way is to think of it as seeking out the hidden assumptions in your reasoning and sorting out the implications of those assumptions on your conclusions and whether they are actually sound. Do they really hold in this case? When ethical reasoning is taught, one method used is the reflective equilibrium. An equilibrium is a balance. In this case, between the moral principles we hold to be true, for example, or the values we do not want to trade off, and the practical realities of the situation. You might think of this as a balance between the ideal world, where it would be easy to follow such principles and act ethically, and the real world, where we need to find a way to do that along with other people, and in a sometimes complicated and often non-ideal world. Achieving reflective equilibrium comes from reflecting on each side in light of the other. How should we think of or change our ideas in light of what is happening and what is possible in the real world? And how should we think of or even change the world in light of our values and principles? The fact is, though, that even if an equilibrium is reached, it usually doesn't last long. This is something we have to keep working on, returning to, and reconsidering. That's the ethical work. The world keeps changing, and so do the values and principles we want to include in our reflections. We want our reflections, like our arguments, to be both valid and sound, correct, but also rooted in the real world, to address both the ideals or goals we have for ourselves as well as our realities, to be both principled and practical. When we can't find a balance, then we can dig deeper and look for hidden premises, hidden assumptions that might be creating conflict. The level of hidden assumptions and premises is often where you will find the source of conflict in an argument, debate, or shared decision-making. First, premises we hold to be true about others we engage with in decision-making processes often remain hidden. These aren't just assumptions about what kind of people they are. They can be about whether you have shared priorities or values, or shared perceptions of the situation. Maybe they think you have the same sense of urgency they do about their situation, but you don't. You feel more confident. Their expectations can make it hard to understand why you are relying on science more than emotion when you make your recommendations. We each rely on our own expertise in the moment. Someone may be considering an issue that isn't at all apparent to others. For example, knowing that your options will be limited for getting certain kinds of medication because of supply chain interruptions. Information that you might be privy to because of your expertise. The context in which you work, the roles you play, can act as hidden assumptions when you're trying to explain your arguments to someone else. If they are to understand how you got from your premises to your conclusion, you have to show them all the premises and make it clear why you think they are true. The next step in ethical reasoning, after reflecting on whether you have the right equilibrium, is to find the values and assumptions that aren't so obvious, but are nonetheless playing a role in your arguments for why certain principles, values, and constraints matter. For example, we might find ourselves frustrated with colleagues who have a different approach to their work than we do. I value organization and efficiency, and if I have to work with someone who moves slowly, I confess I find it difficult not to focus on the lost time or the need to recalculate my organized approach to getting something done because someone has taken a different path I didn't expect. Fact is, I cannot make someone else move faster. I have to weigh this constraint against my values of efficiency and speed. Finding a way around this takes considering also the values of the other. Working together doesn't mean working around others as though they are mere constraint. They have their own equilibrium to reflect upon. And between us, additional equilibria are at play. Ethical reasoning is a balancing act, and we do it all the time. I mentioned earlier that we have many hats to wear as reasoners in practice, so really there are a lot of things to balance. Perhaps it's time for a recap of the tools that I have given you in this short lecture, and to finish off. First, assumptions or hidden premises are part of every argument and justification, whether for actions or decisions. So digging around for them is just part of good ethical reasoning, and start with your own. A sound argument is also valid. The premises, sometimes evidence, and the conclusion have to be logically connected to each other and also true. Checking on the truth and importance of our hidden premises in our arguments about why we think a decision is the right one, or why we believe certain behaviors are right or wrong, for instance, is a key step toward ethical insight, a way to see what values and constraints are playing a role in your reasoning and when. A reflective equilibrium is not the kind of ethical reasoning, but a way it can be practiced. Balancing is not something one does while standing still, but while swaying a bit. It's fine to need help, even while thinking through your own personal hidden premises and principles. We often do our best ethical reasoning in practice and in collaboration, because different perspectives help us imagine new ways to work with each other. There may be a way to work out my impatience with my colleague by reorganizing our space in a way that we don't interfere with each other's pace. But we have to talk this through to figure it out, and it may take more than one go. Values and preferences and principles are not just additional considerations in decision making. They are not separate from the rest of what we think. They influence it. Our scientific values guide us to detect insufficient evidence, for instance. But the very concept of evidence is guided by our values about what is important to know about a patient or about a drug to determine the best information for choosing the best intervention. These sometimes hidden assumptions are part of all of our reasoning. And ethical reasoning is when we aim to make them transparent and understand them in order to better reason together. Thank you.